Hello, and welcome to Behavioral Growth, where we share useful and interesting information about various topics around behavioral science. In today's video, we're going to talk about autism, a condition that affects how a person perceives and interacts with the world. Autism is also known as Autism Spectrum Disorder, or ASD, because it can vary widely in its symptoms and severity. Some people with autism may have mild difficulties, while others may have severe challenges. Some people with autism may have normal or high intelligence, while others may have learning disabilities. Some people with autism may be able to live independently, while others may need support and care. According to the Centers for Disease Control and Prevention, or CDC, about 1 in 54 children in the United States have been diagnosed with autism as of 2021. This means that autism is more common than you might think, and that you may know someone who has autism, or you may have autism yourself. Autism can be diagnosed as early as 18 months of age, but sometimes it can be missed or misdiagnosed, especially in girls and women who tend to mask their symptoms better than boys and men. So how can you tell if someone has autism? Or if you have autism yourself? Well, there is no definitive test or checklist that can diagnose autism, as each person with autism is unique and different. However, there are some common signs and characteristics that can indicate autism, or at least suggest that further evaluation is needed. In this video, we're going to share with you the 10 most common traits of kids and people with autism based on the latest research and evidence. These traits are not meant to be used as a diagnosis tool, but rather as a guide and a reference to help you understand and recognize autism better. So let's get started. Trait 1. Problems with social communication and interaction. One of the most noticeable and consistent traits of autism is having problems with social communication and interaction. This means that people with autism may have difficulty understanding and expressing themselves, verbally and non-verbally, and relating to others emotionally and socially. For example, people with autism may avoid or not keep eye contact, which is a way of showing interest and attention. Not respond to their name or appear not to hear you at times, which may seem like they are ignoring you or not paying attention. Not show facial expressions, such as happy, sad, angry, or surprised, which are ways of conveying emotions and feelings. Not play simple interactive games, such as peekaboo or pat-a-cake, which are ways of engaging and bonding with others. Not use gestures, such as pointing, waving, or nodding, which are ways of communicating and indicating intentions and preferences. Not share interests with others, such as showing you an object that they like, or looking at what you are looking at, which are ways of connecting and relating to others. Not notice or care about other people's feelings, thoughts, or perspectives, which may seem like they are selfish, rude, or insensitive. Not join or initiate social interactions, such as conversations, play, or friendships, which may seem like they are shy, aloof, or isolated. These problems with social communication and interaction can make it hard for people with autism to form and maintain relationships, and to fit in and function in society. Trait 2. Restricted or repetitive behaviors or interests. Another common and distinctive trait of autism is having restricted or repetitive behaviors or interests. This means that people with autism may have behaviors or interests that are unusual, intense, or limited, and that may interfere with their daily life and development. For example, people with autism may
line up toys or other objects, and get upset when the order is changed, which may indicate a need for order and predictability.
repeat words or phrases over and over, which is called echolalia, which may indicate a difficulty with language or a way of coping with stress or anxiety. Play with toys the same way every time, or focus on parts of objects, such as wheels, which may indicate a lack of imagination or a preference for details. Have obsessive interests, such as trains, dinosaurs, or maps, which may indicate a high level of curiosity or a way of coping with boredom or anxiety. follow certain routines, and get upset by minor changes, which may indicate a need for stability and consistency. Flap hands, rock body, or spin self in circles, which are called stimming, which may indicate a way of expressing emotions or regulating sensory input. Have unusual reactions to sensory stimuli, such as sounds, smells, tastes, textures, or lights, which may indicate a hypersensitivity or a hyposensitivity to sensory input. These restricted or repetitive behaviors or interests can make it hard for people with autism to adapt and cope with changes, and to learn and grow. Trait 3. Delayed or different development. Another common and important trait of autism is having delayed or different development. This means that people with autism may have skills or abilities that are behind or ahead of their age or peers, or that are different from the norm or the expectation. For example, people with autism may have delayed language skills, such as not babbling, pointing, or speaking by certain ages, which may indicate a difficulty with communication or a lack of interest in social interaction. Have delayed movement skills, such as not crawling, walking, or running by certain ages, which may indicate a difficulty with coordination or a lack of interest in exploration. Have delayed cognitive or learning skills, such as not recognizing colors, shapes, or numbers by certain ages, which may indicate a difficulty with attention or a lack of interest in learning. Have different or uneven skills, such as being very good at math, music, or memory, but very poor at reading, writing, or social skills, which may indicate a difference in brain functioning or a preference for certain types of information. These delayed or different developments can make it hard for people with autism to meet the expectations and the demands of their family, school, or work. Trait 4. Hyperactive, impulsive, and/or inattentive behavior. Another common and challenging trait of autism is having hyperactive, impulsive, and/or inattentive behavior. This means that people with autism may have difficulty controlling their impulses, emotions, and actions, and may act in ways that are inappropriate, disruptive, or dangerous. For example, people with autism may be hyperactive, which means that they may be very active, restless, or fidgety, and may have trouble sitting still, staying calm, or sleeping. Be impulsive, which means that they may act without thinking or without considering the consequences, and may have trouble waiting, taking turns, or following rules. Be inattentive, which means that they may have trouble paying attention, focusing, or listening, and may have trouble completing tasks, following instructions, or organizing their work. These hyperactive, impulsive, and/or inattentive behaviors can make it hard for people with autism to learn, work, or play with others, and to avoid trouble or harm. Trait 5. Epilepsy or seizure disorder. Another common and serious trait of autism is having epilepsy or seizure disorder. This means that people with autism may have abnormal electrical activity in their brain that can cause sudden and uncontrollable movements, sensations, or changes in consciousness. For example, people with autism may have convulsive seizures, which are the most common and recognizable type of seizures that can cause stiffening, shaking, or jerking of the body, and can cause loss of consciousness, breathing problems, or injuries. Have non-convulsive seizures, which are less common and less noticeable type of seizures that can cause staring, blinking, chewing, or twitching of the face, eyes, or limbs, and can cause confusion, drowsiness, or memory loss. Have absent seizures, which are a type of non-convulsive seizures that can cause brief and sudden lapses of awareness and can cause blank or vacant stares or brief interruptions of speech or activity. According to the CDC, about 1 in 4 children with autism have epilepsy, and about 1 in 3 adults with autism have epilepsy. The exact cause and the relationship between autism and epilepsy are not fully understood, but they may share some genetic or environmental factors, or they may affect each other's brain development or functioning. Epilepsy or seizure disorder can make it hard for people with autism to maintain their health and safety and to participate in their daily activities. Trait 6. Unusual eating and sleeping habits. Another common and troublesome trait of autism is having unusual eating and sleeping habits. This means that people with autism may have preferences, patterns, or problems with their food intake or their sleep quality or quantity. For example, people with autism may have unusual eating habits, such as being very picky or selective about their food choices, or having a very limited or restricted diet, which may indicate a sensory issue, a routine issue, or an anxiety issue. Have eating problems, such as eating too much or too little, or eating non-food items, such as dirt, paper, or soap, which may indicate a nutritional issue, a medical issue, or a behavioral issue. Have unusual sleeping habits, such as having difficulty falling asleep, staying asleep, or waking up, or having irregular or inconsistent sleep schedules, which may indicate a biological issue, a sensory issue, or an anxiety issue. Have sleeping problems, such as having too much or too little sleep, or having poor quality or interrupted sleep, which may indicate a health issue, a mood issue, or a behavioral issue. These unusual eating and sleeping habits can make it hard for people with autism to maintain their physical and mental well-being and to cope with their daily challenges. Trait 7. Anxiety and depression. Another common and distressing trait of autism is having anxiety and depression. This means that people with autism may have feelings of worry, nervousness, fear, sadness, hopelessness, or emptiness that can affect their mood, thoughts, and behavior. For example, people with autism may have anxiety, which means that they may feel anxious or stressed about certain situations, events, or people that they perceive as threatening, challenging, or unpredictable, such as social situations, changes, or transitions. Have depression, which means that they may feel depressed or unhappy about themselves, their life, or their future, that they perceive as hopeless, meaningless, or worthless, such as their identity, their relationships, or their goals. Have anxiety and depression, which means that they may have both anxiety and depression, and that they may experience a vicious cycle of negative emotions and thoughts that can worsen each other. According to the CDC, about 1 in 3 children with autism have anxiety, and about 1 in 4 children with autism have depression. According to a study by the University of Cambridge, about 66% of adults with autism have anxiety, and about 35% of adults with autism have depression. The exact cause and the relationship between autism and anxiety and depression are not fully understood, but they may be influenced by genetic, biological, psychological, or environmental factors, or they may be a result of the difficulties and the stress that people with autism face in their life. Anxiety and depression can make it hard for people with autism to enjoy and appreciate their life and to cope with their emotions and thoughts. Trait 8. Attention Deficit Hyperactivity Disorder, ADHD. Another common and overlapping trait of autism is having Attention Deficit Hyperactivity Disorder, or ADHD. This means that people with autism may have problems with attention, hyperactivity, and impulsivity that can affect their learning, working, and playing. For example, people with autism may have attention problems, which means that they may have trouble paying attention, focusing, or listening, and may get easily distracted, bored, or confused by irrelevant or unimportant stimuli, such as noises, lights, or movements. Have hyperactivity problems, which means that they may be very active, restless, or fidgety, and may have trouble sitting still, staying calm, or sleeping, and may move around, talk, or make noises excessively or unnecessarily. Have impulsivity problems, which means that they may act without thinking or without considering the consequences, and may have trouble waiting, taking turns, or following rules, and may interrupt, blurt out, or touch things inappropriately or rudely. According to the CDC, about 1 in 2 children with autism have ADHD, and about 1 in 4 adults with autism have ADHD. The exact cause and the relationship between autism and ADHD are not fully understood, but they may share some genetic or environmental factors, or they may affect each other's brain development or functioning. ADHD can make it hard for people with autism to learn, work, or play with others, and to avoid trouble or harm. Trait 9. Intellectual disability or learning disability. Another common and variable trait of autism is having intellectual disability or learning disability. This means that people with autism may have problems with intelligence or learning that can affect their cognitive, academic, or adaptive skills. For example, people with autism may have intellectual disability, which means that they may have an IQ score below 70, and may have difficulty with reasoning, problem-solving, or abstract thinking, and may have difficulty with daily living skills, such as self-care, communication, or socialization. Have learning disability, which means that they may have an IQ score within the normal range, but may have difficulty with specific areas of learning, such as reading, writing, or math, and may have difficulty with academic skills, such as comprehension, memory, or organization. Have intellectual disability and learning disability, which means that they may have both intellectual disability and learning disability, and that they may have difficulty with both general and specific areas of learning and functioning. According to the CDC, about 1 in 3 children with autism have intellectual disability, and about 1 in 5 children with autism have learning disability. According to a study by the University of Cambridge, about 31% of adults with autism have intellectual disability, and about 16% of adults with autism have learning disability. The exact cause and the relationship between autism and intellectual disability or learning disability are not fully understood, but they may be influenced by genetic, biological, or environmental factors, or they may be a result of the challenges and the stress that people with autism face in their life. Intellectual disability or learning disability can make it hard for people with autism to learn, work, or function in society, and to achieve their potential and their goals. Trait 10. Savant syndrome or exceptional abilities. Another rare and remarkable trait of autism is having savant syndrome or exceptional abilities. This means that people with autism may have skills or abilities that are extraordinary, unusual, or advanced, and that are beyond their age or peers, or beyond the norm or the expectation. For example, people with autism may have savant syndrome, which means that they may have extraordinary skills or abilities in one or more domains, such as memory, calculation, music, art, or language, that are not explained by their general intelligence or education, and that are often accompanied by intellectual disability or learning disability. Have exceptional abilities, which means that they may have advanced skills or abilities in one or more domains, such as math, science, engineering, or technology, that are not explained by their general intelligence or education, and that are often accompanied by normal or high intelligence or learning ability. According to a study by the University of Wisconsin, about 1 in 10 people with autism have savant syndrome, and about 1 in 200 people with autism have exceptional abilities. The exact cause and the relationship between autism and savant syndrome or exceptional abilities are not fully understood, but they may be influenced by genetic, biological, or environmental factors, or they may be a result of the differences or the enhancements in brain functioning or structure. Savant syndrome or exceptional abilities can make people with autism stand out and shine, and to contribute and excel in their fields of interest and expertise. So, these are the 10 most common traits of kids and people with autism that can help you understand and recognize autism better. Of course, these traits are not exclusive or definitive, and they can vary widely from person to person and from time to time. Autism is a complex and diverse condition that can affect people in different ways and to different degrees. Autism is also a spectrum that can include many subtypes and categories, such as Asperger's syndrome, pervasive developmental disorder, not otherwise specified, or childhood disintegrative disorder. The best way to diagnose autism is to consult a qualified professional, such as a pediatrician, a psychologist, or a psychiatrist, who can conduct a comprehensive and individualized assessment, and who can provide a reliable and valid diagnosis. The best way to treat autism is to seek appropriate and timely intervention, such as behavioral therapy, speech therapy, occupational therapy, or medication that can address the specific needs and goals of each person with autism, and that can improve their quality of life and well-being. The best way to support autism is to raise awareness and acceptance, such as by educating yourself and others, by celebrating the diversity and the uniqueness of people with autism, and by advocating for their rights and their opportunities. The best way to live with autism is to embrace and appreciate it, such as by recognizing the strengths and the talents of people with autism, by respecting their choices and their preferences, and by loving them for who they are. We hope you enjoyed this video and learned something new and useful. If you did, please give it a thumbs up and share it with your friends and family. If you have any questions, comments, or suggestions, please leave them in the comment section below. And if you want to see more videos like this, please subscribe to the Behavioral Growth channel and hit the bell icon to get notified of new uploads. Thank you for watching, and see you in the next video.